Good day, everyone. Welcome to Our Issues Birmingham. If you notice, I don't have my normal background. However, I do have one of my favorite guests and a longtime friend of mine, Dr. Mark Wilson with the Jefferson County Department of Health. He's a public health officer. Welcome to our show again, Dr. Wilson.
Thank you, sir. It's great to be on the show. I wish I could be outdoors with you right now.
Well, we're exercising social distancing, which I wish more people would come to realize is important.
Yes, and there are very pleasant ways you can figure out how to do that, I think, and still enjoy life some.
So we're always exposed to the national news media, and today I don't think we want to address specificity in terms of statistics. I think we should spend our time talking in terms of generalities and things that we can do as a community to help, as they say, flatten the curve, not to use a new word that nobody used before now. It reminds me of the words quid pro quo. Nobody used those words, and now we're using words flatten the curve. So,
and how PPE, there's another one.
Yeah, that's true, all of that. So there's a little bit of delay when we speak. So it's okay, that's normal. I just want the world to know that these are different circumstances than we normally operate under. So with that being said, let's talk generally about what Alabama doesn't have right now that seems to be a hot spot, as that is a stay-in-place order on a statewide basis, although we do have that going on in a lot of communities. Your comments about what's going on, I'm not asking you to diss on the governor, but because I think finally she will come around. But what could you suggest we do that we're not already doing?
Yeah, I think, there are orders that can be issued, and I've issued a few, and I was actually very pleased that the governor issued an order statewide. I was grateful for that. And there are a lot of things that I had to consider when I issued my order, and I know that she has a lot of very difficult things she had to weigh in making that decision. So it's not easy. I can attest to that, no matter what position you're in, whether it's at the local level or the state level. It's heart-wrenching, as I've used that term before, because it's painful. I think, though, that I would rather not issue another order or anybody have to issue orders. What I would prefer is that everybody really understands what we're trying to achieve here and take personal responsibility. Because, orders, if people don't understand them and why we're doing them, a lot of people are just going to try to get around them, right? They're going to find ways. We even have attorneys to help us with that, right? So that's law enforcement. And to people that are always asking, like, well, what if I do this and what if I can do that? Now, some of them, that's really well intended because they don't want to get afoul of the law. And these orders are actually legal orders. So, a lot of people are asking questions because they want to do the right thing. But if people are asking questions because they're wondering what they can sort of get away with, and they're only focused on the rule, then they're missing the whole point. The point is to do everything you can do to keep from spreading the disease from yourself to somebody else, or from somebody else to you, that then will go on in a chain that might get to somebody that's going to die from this. And that's the way I want people to think about it. Another way I want people to think about this is we discovered, after the Wuhan experience and South Korea, and we're getting a lot of data, we discovered that up to 50% or so of people, maybe even 60% of people that are out in the community that are infected have no symptoms. Okay, now they may eventually get symptoms, but some will not. And especially the children may not, but they're all still infected and they can spread the disease. So I want to make sure people understand that. So you know what I do?
What's that?
Every day, from the time I get up to the time I go to bed.
Which is probably a pretty short window.
Pardon me?
Probably a pretty short window of time.
Yeah, it's varied a lot from from like 2 hours of sleep to 7 hours of sleep. That's been my range. The 7 was wonderful. And on the 2 hour sleep night, I got a lot done. So, but anyway, not to get off track here, but the thing I was going to say is the way I think is that I might have it. I'm thinking that right now, like that's a true statement. I might have COVID-19. Now I feel okay, but I also assume that the people I work with every day, and we've sent a lot of them home, I assume that my wife might have it. Now, both my wife and I are being extremely careful, so I think, we don't worry about that quite as much. But anybody else I come in contact, I assume I have it, and I assume they have it, and I behave accordingly. Meticulous hand washing, thinking about every doorknob and elevator button. I use my elbows a lot to open things. I open things with a napkin or a paper towel instead of my hand. But if I touch something that somebody else has touched, I go to the sink as soon as I can, wash my hands. And I keep my 6 foot distance. Somebody's coming towards me in a hallway, I get out of the way. I back up. I do whatever. That's what I'm doing every day.
And if you're in a grocery
store, I want
store,
everybody to do.
And if you're in a grocery store, you don't congregate in the aisle.
Right.
If the aisle is occupied by a number of people, you go to a different aisle.
That's right. And also, if a lot of the stores are being really careful. They're only letting so many people in at a time, trying to comply with the orders. But the other thing is, don't form a line out. If you have to form a line outside, keep that 6 foot distance. And that's another concern. So there's just all sorts of, it's like whack-a-mole, right? You try to crack down in one area and it pops up another. But the reason it pops up in another is because people aren't quite getting it. And they're going by the rules. And I will say that I'm concerned about, these essential services like groceries, drugstores, things like that. We're keeping those open so people can get what they need. Essential. Don't go out just shopping because it's the weekend and it's nice outside and you want to go, maybe buy some gardening things and things like that. That'd be lovely to do in normal times, but right now, we really ask you not to do that. If you need food, do that, but don't shop more, spread out your shopping. Try to get what you need and try not to go back too often.
Well, let's take a break right there. Let's take a break right now and come right back to you. And we'll pick up with some things that feed off of what you just said. This is Our Issues Birmingham. We'll be right back. Welcome back to Our Issues Birmingham. Dr. Mark Wilson is with us today. We're delighted to have you and we appreciate you taking the time. I know you're exceptionally busy these days. So we were talking about grocery stores and people going out and just getting the essentials. It's not like a free pass to go out and be like the way things were a month ago. What about places like Target or Walmart or Sam's or Costco? And I'm not dissing those stores, but what do you ask people to do when they're in places like that, stocking up on things?
Yeah, well, it's a difficult situation. And, for one thing, we've closed down a lot of retail stores that sell just clothing or just leather goods, things like that. And the reason we left the big box stores open is because they do carry essential items. And in some communities, a Walmart might be the only grocery store there is, some of our small towns and rural areas. So we can't shut those down, but we don't want people going there to buy their clothing and things like that right now. Now, we hope we can get to the point where we can get back to normal. We all want to, right? But we just want you going to those places for essential items. I'm keeping an eye on that, and this was pre-recorded, but I'll just say that's just been a big area of concern for me, and I do have some authority to take further action if needed. And our police, our law enforcement have authority to help help us with that. And I have actually asked law enforcement in Jefferson County to, all local law enforcement, I've asked them to go and patrol these areas and make sure that they are complying, and if not, take action. Okay. And so really what my message to the public is, don't go if you don't need to, because there's going to be police there telling you to, to break it up, and you just go if you don't have to in the first place.
Well, and I think what you're also saying is we're not trying to create a police state. We're trying, from what I gather from information I have from law enforcement, is they're trying to take a kinder, gentler approach to it, at least initially.
That's right. And I made that very clear too. I mean, we all know how things can go bad with police interactions. And even when nobody means something to go bad, we're not, the last thing we need is more people in our jails. We're trying to get people out of our jails right now, or spread them out in order to avoid there being a terrible outbreak of disease in our jails. I'm real worried about that too right now. And the people that work in those jails, our guards and staff, I'm trying to protect them. And in doing all of that, we're trying to protect our whole community. Okay. So we're not asking police to get rough on people and stuff. We're just asking for their assistance and helping people comply gently. But they still have that badge on, and they have authority. So we're using it. And yet none of us wants a police state. I'm not a power hungry person either. People that know me know that's not me. But I'm fighting for our community. And it's because I care deeply about this community. I've been here a long time. I raised my family here. I love the people here. And that's why I'm being so aggressive. It's because I'm trying to save people's lives, and those lives might be people we know personally and love personally.
And I do want to come back and talk about that. But before we move along from the enforcement issue, I get complaints, read complaints about young people congregating, whether it be in parking lots or what young people do where they arrive. The enforcement of that has to come from the parental unit, at least amongst the adolescents of the world. Are you hearing things along these lines like I'm hearing to try to break up these?
Yes. Yeah, I hear different anecdotes. I've been sort of cooped up in either at home or the office working like crazy, so I don't get out much, but I hear stories and anecdotes. And we do, our appeal really is to the parents. And I think to help our kids understand, we don't want to scare the little children, but for the adolescents, I think that if they really understand this, they'll be responsible. The vast majority of them, they're not stupid. And our adolescents, as I understand it, I don't think any of us claim to completely understand teenagers, but I think one thing that's true of teenagers is if you appeal to their sense of relationship and the people that they care about, whether it be their friends or their family members, they'll get it. So if you help a teenager understand that just what they think is an innocent interaction, like playing a pickup game of basketball, which is a contact sport, or just running around and whatever, where they're coming in close contact, physical contact, that can end up killing your grandmother. Yeah. And I'm not kidding. Yeah. I don't want to over dramatize things, but that is a possible scenario. And who wants to do that?
No one. Stay there. I'll be right back. This is Our Issues Birmingham. We're going to take a short break. We'll be right back. Welcome back to Our Issues Birmingham. Dr. Mark Wilson is with us today, and we're talking about what's going on in our society today. Thanks for your invaluable information. You mentioned briefly in the last segment about our ventilator shortage, our potential ventilator shortage. Where are we with that issue right now specifically?
Yes, the last report I got was that we still have plenty of ventilators available right now, at least in our local hospitals here in the Jefferson County area. But all the hospitals across the state, they keep a tab of how many ventilators there are total and how many ventilators are in use. And also things like hospital beds and ICU beds, all that is kept track of and is being followed by our hospitals, by the Hospital Association. So we have a finite number, and the current projections, if you're looking at that curve we're talking about trying to flatten, and these are crude projections, but there are projections that Alabama, there's a very good chance Alabama could get to the point where they do not have enough ventilators for all the people with COVID-19 who are experiencing respiratory failure, who can't live without assistance of a mechanical ventilator. Now, there's a lot of innovation going on. They're taking anesthesia machines and using them as ventilators. There's some innovative engineers that are converting CPAP machines into, that people use for sleep apnea, converting some of those into ventilators. So there's a lot of innovation that gives us some hope. But that's one of the things I'm really fighting for, and other people really fighting for, is to avoid a really unthinkable situation that we are not used to having in this country, but that they did experience in Italy, where they are having to decide who gets a ventilator and who doesn't.
Yeah.
And that's just horrific. Sometimes we turn ventilators off and people are at end of life and it's futile and there's no hope and they have an advance directive. But that the idea of deciding based on age or based on prognosis, maybe one person has a better prognosis than another, that this person will get a ventilator and that person will be put off on a bed somewhere and given morphine. I don't want us to go there.
No.
I don't want our healthcare workers, including my own daughters and friends, to be put in that emotional, in that sort of situation where they experience that sort of emotional trauma.
Yes.
So that's just one scenario, and I don't mean to be too dramatic, but I'm just telling people that's the situation. And ventilators from the federal government, from other states, they do not exist. We're on our own here right now. There's a strategic national stockpile of supplies that's set aside for disasters. They've already opened that up.
Have they exhausted it? I'm sure they have.
In terms of most things, like the face masks, N95 masks, they've already distributed all of those. And of course, those are in short supply too.
Well, as we wrap up this show today, I'd like to talk about things that this country has been through historically. That I do remember getting my polio vaccine. I remember getting it on a sugar cube. My wife remembers it as an injection. Either way, it was a serious epidemic in the 50s. Prior to that, of course, we had the flu, the Spanish flu in 1917 and 1918 time frames. What I would like our viewers to understand is what we're involved in at this moment is certainly a very difficult circumstance and a very hard left turn in the way we've known things to be in the past. What I want them to go away feeling is there is another side to it, and we will get there. Can you address that for us?
Yes, I will. The polio epidemic is a great example. It was horrifying at the time, that your child might die or be permanently crippled. And, so they closed swimming pools. The public health took action. The flu epidemic of 1918 was horrific. Millions of people died. A lot of lessons were learned from that. Look it up sometimes. St. Louis versus Philadelphia flu pandemic, 1918. St. Louis had really strict social distancing orders at that time. They quarantined the city strictly and they held to it for a long time. Philadelphia had some, but then they decided to have a big parade before it was over. The death rates between St. Louis and Philadelphia were dramatic. So we know that what we're doing works. And we also have evidence even now that our current measures across in other places in the country, in other countries, have worked. So hang in there, everybody. This is all for good. It's hard to do, but I have a lot of hope that what we are doing is making a difference and has already made a difference. Join us in that effort. We can continue to save lives. I also just want to say the support in Jefferson County among all of our mayors and all of our county commission people has been amazing, unprecedented. I think never before seen in the history of Jefferson County have we had so much cooperation, people suspending the politics and the petty differences and working together. So I have a huge amount of hope in that and the generosity of our community to support everyone who's suffering hardships while we go through this.
Thanks so much for being with us today. I have one piece of advice to the viewing audience. I'll make it brief. Stay home. End of story. Unless it's essential, stay home. Unless it's an emergency, stay home. This is Our Issues Birmingham. Special thanks to Dr. Mark Wilson with the Jefferson County Public Health Department, and we'll see you next week.